Okay, so we're live. Good morning, everyone, and welcome to today's media briefing. I have a couple of announcements for you before we get started. So Tuesday's media briefing will be canceled. June 16th is also committee day, and Dr. Wang will provide a COVID-19 update as part of her committee update. And then if there are any questions or follow-up after the fact, you can email me and I'll be sure to follow up with the response. Also wanted to just flag that next Friday we'll be joined by Dr. Julie Emily, who is our acting Associate Medical Officer of Health. She'll be filling in for Dr. Wang on Friday to provide the update and answer questions. So now we'll move on to our speakers. So today we're going to hear from Acting Medical Officer of Health, Dr. Hsiu-Li Wang, as well as Regional Chair Karen Redman, and then finally from Region of Waterloo CAO, Mike Murray. And we'll get started with Dr. Hsiu-Li Wang. Go ahead, Hsiu-Li.
Good morning, all. So I'd like, is that okay? Is the sound okay? Yeah, okay. So I was hearing some feedback. I'd like to begin by providing an update that our Waterloo Region COVID-19 dashboard will be updated Monday to Friday at 10:30 a.m. beginning today. So the next dashboard update will be on Monday, June 15th at 10:30 a.m. COVID-19 is still circulating in our community. Continuing public health practices will be of utmost importance. So while our new rate of cases has improved since our peak in April, the risk is still present across our community. The pandemic is not over. With increased testing, we are able to pick up more cases. We have new cases reported every day. COVID-19 is still circulating in our community. The infection is spread from person to person. As restrictions are lifted and more people interact with others, we can expect to see more cases reported, including more cases among workers. That is why it is of utmost importance that we all continue with the recommended public health practices. These public health practices need to be our new normal, and they need to be practiced all the time. We all have a collective responsibility to do what we can to minimize the spread of COVID-19 in our community, not only to protect our health and the health of our families, friends, and neighbors, but also so that we can successfully lift restrictions and open our economy and keep it open. This is also very important for our health and well-being. We have a collective responsibility to protect one another. That is why we need to continue to practice physical distancing between ourselves and others outside of our households. Remaining 6 feet apart is key. Wearing a mask when we are around others, especially when we are around others in an indoor setting or on public transit. While some of us cannot wear masks, ideally, the vast majority of us will wear masks when we are in close proximity to others. Please remember, though, that a mask does not replace physical distancing, which we should try to maintain whenever we can. Continuing to wash our hands often, trying not to touch our faces, and finally, staying home, self-isolating from others if we develop any symptoms, and if we do, no matter how mild, it is essential that we get tested. These practices must become part of our daily lives. The health and well-being of our community depends on everyone doing our part and helping each other practice these measures and living our new normal. Thank you.
Thank you, Dr. Wang. We'll now hear from Regional Chair, sorry, Karen Redman, go ahead.
Thanks, Julie. Good morning, everyone. I know that it's welcome news to all of us that the province has lifted restrictions for Waterloo Region and that areas of our economy are able to open again. Splash pads, campsites, hairdressers, and restaurant patios can proceed to gradually reopen in Waterloo Region. This means we've done a good job and we're moving in the right direction as a community. I think we've all settled into the fact that being physically distant, having good hand hygiene, and wearing face coverings has become part of our new normal. As we transition to this new reality, to our next reality, the uncharted territory of stage 2, we cannot jeopardize all the gains that we've made so far. Simply, we cannot relax. Many businesses have recalled staff and are beginning to open up under new guidelines and rules. I would ask you to please be patient with them. They will be going through many extra steps to keep their customers and their staff safe, and it may take longer and maybe be very different than the experience we had before COVID-19. The region's main administrative buildings will be open to the public beginning June 15th, 2020. You may notice some changes in our facilities, including plexiglass barriers, new physical distancing signage, and more hand sanitizing stations. Although some of our buildings will be open, services for our citizens will remain limited, and most will be able to be provided online. If you need a visit the administrative building, I encourage you to call ahead or make an appointment whenever possible. We're also working hard to meet the new provincial guidelines and protocols so that we can reopen our childcare centers, library branches, and regionally operated museums. This will take some time, and we hope to share more details in the coming week as to the timing of those openings. As we cautiously reopen, our continued vigilance and diligence in practicing physical distancing, hand washing, and wearing a face cover will determine how quickly we move to stage 3, or if we move backward to stage 1. We have all worked so hard to get here, and I know we all will work together to protect each other through this next phase. The weather this weekend looks great. I hope all of you get a chance to get out and enjoy your weekend. I ask you to respect our green spaces, our parks, and our conservation areas. As we've seen recently, Conservation Authority of Grand River has had to close some areas. Be respectful of your surroundings and others so we don't have to have this backward step. Thank you.
Thank you, Karen. We'll now hear from CAO Mike Murray. Go ahead, Mike.
Thanks, Julie. So I'll provide my brief Friday enforcement update. So enforcement actions, monitoring, inspection, enforcement actions continue by all 4 enforcement partners. So again, those are regional bylaw, area municipal bylaw, public health inspectors, and Waterloo Region Police. So over the last week or so, there have been 188 site visits that involve education and/or warnings issued to people. There have been 281 site visits where no action was required. So again, inspector showed up and things were fine. They were fully in compliance with emergency orders. And 2 new charges laid over the past week. Both of these in the city of Waterloo, and both of these private residences with gatherings of more than 5 people. So, I think it just reinforces the point that Dr. Wang has made and that Chair Redman has made, that emergency orders are still in effect. They are changing, but people need to remain aware of what the orders are and need to remain aware that enforcement of the orders that are in effect will continue. So that's the enforcement update. And as always, we're all happy to answer any questions.
Thanks, Mike, and thanks to all of our presenters. So we'll turn it over now to you for questions, and we'll start with Kate from CBC. Go ahead, Kate.
Thank you. Dr. Wang, my first question is for you. And earlier this week, I talked to Dr. Mercer in Wellington, Dufferin, Guelph, and she was talking about how anecdotally, they're seeing fewer people wearing masks, which is why she went ahead with the order to have people wear masks. I'm wondering if you have also seen that. I know that you wouldn't have numbers of how many people are wearing masks, but are you seeing people in the region sort of become a little more apathetic towards the public health measures that you've put in place and wearing masks and those sorts of things?
Sorry. So anecdotally, what I've seen is that, over the last number of weeks, I've actually heard and seen myself, although, like you said, I don't have the full stats, that there's actually a trend towards more of our residents overall embracing face coverings and masks. So, for me, I think this is a community change that I want to continue to strongly encourage, so that the vast majority of us, when we are in a setting where we are in close proximity to others, or could be, that we wear masks or face coverings. And if many of us do that, if the vast majority of us do that, then we will protect each other.
And do you think that's something that's a forever change?
I think that it's something that is going to be essential as part of the suite of practices that I previously outlined. That's going to be something that's going to be essential for us to continue to practice until this pandemic is over, until a vaccine is found and or a treatment is found, and it's really over.
And this would either be for Chair Redman or Mike. Chair Redman, you mentioned in your opening statement about GRCA having to close some parks because of the garbage and that. Do we have a sense of whether crews found similar problems? Like there was issues with people overcrowding parks, parking was a mess. Apparently they were just parking wherever they felt like it. Garbage being left everywhere. Did we see that in the regional parks, or did you hear it from the lower tier municipalities?
So I might comment. No, actually, I've not heard this from the area municipalities. But I heard, Councillor Jawed on the radio this morning talking about, the challenges that GRCA had experienced last weekend. But no, I hadn't not heard the same issues with area municipal parks.
And if I can just add, Kate, and these are decisions that are made by the GRCA board clearly, but the reality was there was no physical distancing. And when GRCA staff were approaching these people in some of the parks, I don't know that it was every park, people were ignoring the directive. And this is new behavior. This is not behavior that I think we have experienced locally at area parks. And it's one of the reasons why the GRCA moved to close down a couple of their facilities.
Okay, that's all I have for now. I reserve the right to jump in later though.
Roger that. Okay, we'll go over to Tim at 570. Go ahead, Tim.
Yeah, this question was going to be for Chair Redman or Mike Murray regarding patios being open in municipalities. What have you heard from municipalities on how to enforce that, make sure that they stay safe and stay physical distance?
Yeah, so I'll comment, and Chair Redman might want to add. It's the ongoing monitoring and enforcement, Tim, that I've talked about. So there will be a number of different groups out and about over the weekend and the coming weeks. So that will include area municipal bylaw, public health inspectors, and if necessary, regional bylaw and Waterloo Region Police. Public health inspectors have a relationship with food and beverage establishments, right? Like they inspect them periodically. And I know that public health has put, guidelines on public health website. These are based on provincial guidelines. There's been really close working relationship between public health, some of the local like BIAs, to make sure that people are opening up in a safe way. So, you know, I credit to the business owners. Like, they are taking this very seriously. They want to reopen, but they want to make sure that they do it in a way that's safe for their staff and that's safe for their patrons. So I would say we're optimistic that people are taking this seriously. Some of them, you know, even self-select and say, you know what, I'm not ready to open because I don't have all the measures in place, you know, which I think is a responsible approach. So I think we're going to see over this weekend a number of establishments open. We believe that they're taking the guidelines seriously, and there's going to be inspectors out inspecting and monitoring. Hsiu-Li or Erin, do you want to add anything?
Yeah, I don't know, Hsiu-Li, do you want to add anything?
No, that was perfect.
Well, so I'll add something, even though it was perfect, Mike.
No, that's right.
I would just say that nobody wants businesses to open more than these businesses. This is day one of phase 2. And we all have to recognize collectively we're one of 24 areas that were allowed to go into phase 2 as of today. So we're counting on the education, the cooperation, and the collaboration of the staff that are in those establishments, of the owners of those businesses that want to open, recognizing that we could revert back to phase 1 if we don't do this right. So I don't think anybody's more invested in asking patrons to separate and to use the protocols that are in place in order to continue to move forward through this phase. So I'm confident that the vast majority of people who want to sit on a patio and the vast majority of staff that are now called back to work are really glad to be back and will adhere to those guidelines.
Now, the announcement of stage 2 was on Monday. How has that process been for the region, region of Waterloo, in order to work with municipalities to get all the patios open? Have you been working with the municipalities on that?
Yeah,
yeah.
so I'll make a couple comments, and then Dr. Wang might want to add. This has been a busy week. I mean, every week's been a busy week, and you know what? I think what we find is, you know, what's critical just changes from week to week. So this week, the focus on reopening has been top of mind. So there've been working groups of regional staff and area municipal staff who have worked diligently, like specifically on restaurants, bars, and patio opening. And how do we do that? And we've identified each municipality and the region single point of contact, so that decisions can get made quickly, approvals can get issued quickly. I would say, you know, the collaboration has been tremendous, so that, you know, in our 2-tier system, we're trying to do everything we can to make a streamlined approach, no finger pointing back and forth. The other thing that's going on is some really interesting work about some establishments want to expand their patios onto adjacent areas, either adjacent private property, like parking lots in strip malls and things, or adjacent public property, curbside lanes on roads. And so there's a lot of work going on between area municipal staff, regional staff, BIAs, and business owners to try to figure out what can be done and what can be done quickly and safely. And, you know, I would say top of mind in all of this is how do we make it safe? And especially patios that are adjacent to roadways, how do we make it safe for people in the patios, and how do we make it safe for users of the roadway? And respecting everybody, right? So, you know, how do you expand a patio and still have enough space for pedestrians? So, yeah, it's been a pretty intense week. And I know it's been intense for public health, and Dr. Wang might want to comment on that.
Yeah, so there was a lot of work done even before the announcement that we would be able to move to stage 2 as of this Friday. We heard the announcement just like everyone else at that same time. So there's a lot of work beforehand, but there's a lot of intense work now, you know, by our public health inspectors to try to make sure that those businesses that can reopen are able to safely do so. You know, there are a lot of new requirements for the businesses, and you know, there's a lot of questions. In addition to the businesses that we generally support, like restaurants and personal service settings and recreational facilities, there's the whole wider business community, right? And the government has published a lot of resources for them, and we try to facilitate, getting that information out to them. So just as an example, I was just pulling up, looking at some stats. So there are 3,200 food premises that we inspect every year, and we estimate about 300 of them have patios. Now, some may choose to maybe add a patio, so that doesn't include that, but roughly around 300 have patios. So there's going to be a number of restaurants that we're going to be, in communication with to try to support them through this opening. We have 850 personal service settings in the region that we're working to support. We have 200 recreational water facilities. We also have 100, these are rough numbers, daycare facilities, right, that we are also supporting to be able to reopen safely. So it's been an extremely busy week for public health.
Now, does a public health inspector have to go into a business if they want to open this weekend prior to reopening? Do they have to go in and inspect it first, or no?
No, it will be based on a risk assessment. They have good knowledge of the premises history and whether there may be some issues with the premise and things like that. So they will make an assessment based on their previous knowledge and based on the risks that they foresee may be present, and they will do their inspections as they judge warranted, and of course they will respond to complaints.
Thank you so much.
Thank you, Tim. We'll move on to Nicole from CTV. Go ahead, Nicole.
Hi, good morning. First question, why not order masks be mandatory in most commercial settings, like in Wellington, Dufferin, Guelph?
Okay. So as we've kind of talked about a little, our businesses are working really hard to reopen, and they have very stringent requirements that they have to meet to be able to reopen. These are the requirements set forth by the province, sometimes supplemented by us with some more clarity details to help them operationalize. But they have a lot of requirements. So I understand, that we want people to wear masks. I want people to wear masks, but I do not believe it is the right approach for us to put the onus on the business owner, operator, to enforce that their patrons wear masks, to determine whether somebody can be excluded or not for health reasons, to potentially have to deal with complaints from other patrons who don't understand why some people may not be wearing masks, and to do this under the threat of a fine of $5,000 a day. I do not believe that that is the right approach at this time. I think that we all have a collective responsibility, as I mentioned, to protect each other. I want the vast majority of us to wear masks whenever we are in close proximity to others, especially in indoor settings and on public transit. And our focus right now is to support the business community to put in place the required measures to safely reopen, to protect their staff, to protect their patrons. And I would like to emphasize again, when we speak with the business owners, like Chair Redman said, there is no one who wants to reopen safely more than the business owners themselves. They and their staff want to do all that is required. And we want to support them, and we will continue to do so. And at the same time, I will continue to ask our population to do whatever we can to help each other, help protect each other. Physically distance, wear a mask if you can. Most of us can. All of us who can wear a mask when you're in close proximity to others. Wash your hands often. Do not go into work when you're sick. Stay at home and get tested. And actually, to answer a question that Kate answered earlier, I just thought of something. You know, we are hearing anecdotally, people are having fatigue with, following measures, and it's good outside, it's nice outside, and there's more, dropping of measures. People are starting to gather together, not caring about if they have symptoms, being around others. I've heard anecdotally of that, right? And that is why I really want to emphasize the pandemic is not over. Yes, our cases now are much better controlled. Things are going well. We're in a position to be able to reopen. We need to do our best. We need to continue to be disciplined and do our best and help each other to stay on the right track so we can continue to lift restrictions and open our economy. That type of lifting of restrictions and opening of our economy is really, really important for health as well. So that is why I really am asking everyone in our community to please, all of us, do all that we can to help each other and to do all those measures that we should be doing to protect each other.
This is along the same lines. We've seen earlier this week the TTC asking their passengers to wear masks. Is that a request going to be made by GRT?
Maybe I'll comment on that. So Nicole, that is a request that has already been made by GRT, by Dr. Wang, by me, by Chair Redman. We've been encouraging all transit users to wear masks for weeks, months, actually. And so we will continue to reinforce that we encourage anyone using GRT who is able to wear masks. And so you're going to see that messaging, ramp up in the days, weeks ahead, strongly encouraging people to wear masks on transit if they're able to. So that's the approach we're taking at this point in time. And as we've said before, we're talking regularly with other transit operators, watching what's going on in other communities. One of the challenges with making masks mandatory on transit is the enforcement issue. And I think if you do some research, what you'll find is, I actually think every municipality that has said masks are mandatory on transit has also acknowledged they're not enforcing that. So the message is the same. We strongly encourage everybody to wear a mask on transit. The challenge with mandatory is how is that enforced? And it's a challenge to put that enforcement onus on a bus operator. They've got a lot of other things on their mind. So that's why we're monitoring this. We're seeing how it goes. It's not a step we're taking at this point, but we want to leave the door open to whatever steps we need to take to try to get more and more people wearing masks on transit.
Thank you. My next question, I guess, could go to either Mike Murray or Dr. Wang. Many people who work in Guelph live in Waterloo region and vice versa. Same could be said for other neighboring communities. And we are hearing from both residents and business owners that different public health orders are confusing to abide by. Is there a consideration to work with neighboring public health units so that there's a bit more uniformity as people, intermingle between our communities?
And I'll let Dr. Wang comment on the working with other public health, adjacent public health agencies, and I think that's happening all the time. I think there's good communication. Dr. Wang, comment. This is where I actually think the province taking more action and providing crystal clear, consistent directions, guidelines, orders that apply right across the province actually would be helpful. If, for instance, if masks are to be mandatory on transit, that should be true right across the province. So I think there's a role for the province to play in trying to avoid sort of this patchwork quilt that's emerging that we acknowledge can be confusing for people.
Yeah, and like Mike said, we are in communication and we try, you know, where we can to align, but each medical officer of health has to make their own decision based on their own assessment of the situation in their health unit area. And I'm sure we all try to make the best decision for our community, you know, whenever we make them. So, you know, you've heard sort of why I've chosen to take the approach that I'm currently taking, you know, I'm sure that other medical officers, when they decide on an approach, they you know, they're doing what they think is best. But understandably, it can create confusion. And I actually echo what Mike said. You know, if there can be greater provincial consistency, that is always welcome. I think you're muted still, Nicole.
No, that's it. Thank you.
Okay, thank you, Nicole. We'll move on to Joanna from the Record. Go ahead, Joanna.
Great, thanks. I had lots of questions about masks too, but those have been answered. I guess my first question for Dr. Wang is, now that visits are going to be opened again in long-term care and retirement homes, what are your thoughts on that? Are you concerned, or is this a good move?
Well, I do think that, you know, we have, as Chair Redman said, you know, this region, people have done lots of hard work to try to get to where we are now, at a stage where we can start to lift some of these restrictions. I actually think it's a good thing. It will require, you know, more effort on the part of homes, and but I actually think that it's a good thing because for residents not to be able to have contact with their loved ones and vice versa, it can impact them psychologically, mentally, you know, and we've seen a lot of, you know, we've heard a lot of stories of people who really want to be able to start visiting their loved ones. So, you know, I think this is, what's happening now is in line with what's happening overall in our community. That is, we're starting to lift restrictions, we're opening up our economy. We still have to do things very carefully. And you'll see with the specific requirements that are set up, that are set out in, you know, in the documents that talk about allowing this type of limited visiting to happen again. There are many requirements that need to be met. So again, it's part of the approach to lift restrictions gradually, carefully, because COVID-19 is still a threat. So I'm very happy that you know, we're now able to lift some of these restrictions for residents and their families. And you know, we're just going to have to continue on the path of lifting these types of restrictions gradually in order to lower the risk that something could resurge rapidly.
Okay, thank you. And then just another question about the retail outbreak, the workplace outbreak. Can you tell us more about that, and should the public be concerned?
Yeah, so this is, you know, as expected, we're going to detect cases among workers. And every time there's a case, public health gets a notification. And then we follow up with the case and we follow up with the contacts. And in this case, you know, there's, I'm just gonna check my dashboard to make sure I don't have the, I did pull it up earlier, but then my screen I must have hit the wrong button. Sorry, just gonna really quickly get that up and answer you. So we have at this point in time, we have a small number of cases. This is not a situation where we believe there is an increased risk to the general public, which is why it is being disclosed, but in aggregate form on our website.
Okay. And then I'm not sure if this is for you or Mike Murray, but just regarding childcare centers, what's going on with that? Is public health or the region providing guidelines for other operators? And then what's going on in the regionally operated childcare centers?
Yep. Thanks, Joanna. And Dr. Wang may want to chime in. There is a huge amount of work going on in the whole childcare sector. The region has a couple of different roles, I think, as you know. So one role, we operate 5 childcare centers. So we're a childcare operator, and we're also the service system manager for childcare. So we've got responsibilities both to operate our 5 centers in a safe and healthy way, and also to try to provide kind of support and assistance to the whole system. And it's really, really challenging to try to open childcare centers in a way that's safe and healthy for everybody involved, for the staff, the children, and their families. And so there's a huge amount of work going on right now. I would say every childcare operator is working on that. The province, to their credit, has released very detailed guidelines around childcare centers. So this is actually one area where, Dr. Wang can comment. I actually think they've done a good job. They've been very clear. The requirements are really stringent and lengthy, but it's a pretty comprehensive checklist. So all childcare operators, I'm sure, are working their way through that right now, as is the region as a childcare operator. We've got a couple of added challenges. One is, as you know, we are operating 2 emergency childcare centers ourselves out of 2 of our centers, and those centers need to stay open until June 26th. And we're working with all the families in those centers on an orderly sort of wind down transition plan for the families who are in our emergency childcare. And then we need to reopen those for regular childcare. So that's in 2 of our centers. We have 2 others that we're working on, the guidelines for opening. And then we've got another one that's located in a school. And so that adds an extra level of complexity, is the coordination between schools, school boards, and childcare system operators. Many childcare centers are located in schools, which, as you know, have been closed. And so now they're working on the whole coordination between the school board, who manages the building, and the operator, who manages the childcare center. So I know, Joanna, that's a kind of long-winded answer, but suffice to say, there is a lot of work going on in the whole childcare sector. And again, I think childcare operators are trying to open as quickly as they can, but they recognize they need to do it in a safe and healthy way. And they're trying to find that right balance. And we'll be reporting, I think Chair Redman said, we'll have more information next week. We're working on an update for regional council on Tuesday. Dr. Wang will do her update, and I'll be doing an update on, what's the reopening plan for regional programs and services, including childcare.
Yes, the childcare operators, the regional staff who play a coordinating role and operate centers themselves, they're working really hard. It's also an area where public health staff are very busy because, there can be a number of questions. We've already been involved with the emergency childcare centers, whenever a child becomes symptomatic, whenever there's a possibility that they were in contact with other children or staff, we're involved. We're involved in supporting all of those, ensuring that the appropriate precautions are put in place for, those particular children that may be symptomatic, for example, and providing recommendations on if they should be tested and things like that, and if other children should be kept at home or should monitor for their symptoms. So we've been quite involved, and with the reopening, obviously we're going to have more childcare centers to support. But it's been very good to be able to work through the region, which is a childcare manager. It facilitates a communication consistently the childcare operators in the region.
You're on mute, Joanna.
Sorry. Thank you. Those were my questions for now.
Okay, thanks, Joanna. We'll move on to Irene from Air News. Go ahead, Irene.
No questions at this time. Thank you.
Thanks, Irene. Okay, and Damon, I don't see any questions in the chat. So no questions. Okay, so now I'll throw it back to everyone. Are there any follow-up questions? Kate, I was hoping you wouldn't let me down. Okay, Kate, go ahead.
Thank you. I did see a post from AR Kaufman YMCA that the temporary shelter there is closing on June 28th, and they're not taking new clients after Monday. So I'm wondering if the region has something in place, or if we'll know Tuesday about what will happen with the people that use that shelter.
Yep. So we'll provide more of an update on Tuesday, but suffice to say, regional staff and a whole host of community partners are working on, the transition plan for shelters, the AR Kaufman Y and other shelters, and looking both at short, medium, and long-term, alternatives for what is the shelter system going to look like post-pandemic. And so we need to deal with the short term, how and where do we house people who've been living at the AR Kaufman Y. So that's, really top of mind and high priority. But then, very quickly also thinking about how do we provide adequate capacity in the shelter system in a pandemic world where people need a little more physical space, and we want to try to create a healthy and safe space for everyone. So yeah, a lot of work going on in that area, and there'll be more information coming, next week and the week after.
And this might be more for Chair Redman than Dr. Wang, but whomever. We saw Toronto Public Health say that the anti-Black racism is a public health issue, and we need to address it. Is that something that the region of Waterloo, which serves as the public health board, will be making further statements on?
So I think, Kate, the way I would put it is the fact that Black Lives Matter has arrested everybody's attention the way it has and created such an outpouring of interest. Racism isn't new. It's been in our community. It's been in our country since for years and years, since Canada was created. Yes, is it a public health issue? It is. It's also a socioeconomic issue. It's also a systemic issue. And it's anybody that is racialized, any minority group that is subject to systemic racism. We need to acknowledge it for what it is and move forward. So I would agree that it is a public health issue, but it can't be solved by public health. So I think it has to be a more comprehensive dialogue moving forward, always with an eye to action, not just to more discussion. So it is not something public health in and of itself can solve, but they need to be at the table and be part of the conversation.
Okay, I'll end there. Thanks.
Okay, are there any other questions? Go ahead, Joanna.
Thank you. Just a question for Dr. Wang. Where is public health with sort of the postal code based case numbers? Is that going to be released soon, or when can we expect that?
Yeah, we're working on it. I think that we've continued to work on it, and I think within 2 weeks we should be able to post that online, and it will be at the neighborhood level, like it has been for the other health units that have released this information.
And that will be posted every day on the dashboard as everything else?
We'll have to see. It will depend on how long it takes for us to update the data. For sure, there's going to be regular updates, but I don't have that specific yet to confirm, but it will be on our dashboard. And yeah, people are going to be able to interact with it. And look for the data that they want.
And you said that's the next 2 weeks, you think?
Yeah.
Yeah. Okay, thank you.
Thanks, Joanna. Anyone else? Okay, seeing no other hands up, we will conclude to, oh, Dr. Wang has something else to say.
I just really want to repeat myself. It's really nice. It's going to be a really nice weekend. There's a little bit of public health measures fatigue. Please, I really ask our community, please don't let up on the measures. They're fundamentally important to allowing us to continue to move through stage 2, and to continue to progress, to allowing our economy to reopen, to allowing the restrictions that we've been able now to lift to be maintained. It's vitally important that we continue to do everything we can in order to help each other and help our community as a whole continue to reopen. And the best way to do that is through those public health measures, right? Maintaining physical distance wherever you can, wearing a mask, if you can. I want to see lots of people physically distancing. I want to see lots of people wearing masks. I want to see lots of people being considerate of each other and using respiratory etiquette if they should cough, or staying away from others if they should get sick, and getting a test. And we've done a really good job. Let's not lose those gains. Let's not let up now. And I hope everyone enjoys the lovely weekend.
Thank you, Hsiu-Li. And thanks to everyone for participating. So we'll wrap up there, and just reminder that we will not see you on Tuesday for this briefing, and Dr. Wang will provide her update via the committee meeting. However, we'll be back here on Friday to provide the regular briefing and update. Thanks, everyone. Have a good weekend.